Hi, my name is Suhail Mithani. I'm an associate professor in plastic surgery and a hand surgeon here at Duke. So our hand surgery service, I think, is a relatively novel one in terms of how it's organized. It's a combined venture between both orthopedics and plastic surgery, with faculty from both the orthopedic side as well as the plastic surgery side of things that work together in a collaborative fashion towards not only patient care, but also the education of residents and fellows. And I think that this is in sharp contrast to the acrimony that you'll sometimes see between the different specialties at other institutions. It really is an extremely collegial environment that is really towards the benefit of the care of our patients as well as the education of our residents and fellows. Duke is a different place. I think that the quality of academics that's provided at our institution is in the top tier of training programs, but its specialness really lies in the fact that the relationships that are existing between the faculty and the residents are genuine and fond, and there's a fondness for each other and a genuine concern for each other's well-being and development that I think is very uncommon at this tier of an academic institution. I think the best thing about being here is the relationships that we have, not only amongst ourselves, but between ourselves and our colleagues in other separate specialties. We work together with many other specialties in plastic surgery because that's our job, to help other people with their problems and help them with their reconstructions. And the relationships that we have with our colleagues in neurosurgery, orthopedic surgery, and urology are almost uniformly affable and collegial, and it's really very, very special and different about our place. So residents rotate on the hand surgery service at two parts of their residency, as a junior resident and as a senior resident. And the model is generally a preceptorship type of model, but when they rotate as a junior resident, they spend most of their time with me. And they many times have not had a significant exposure to hand surgery. And it's really gratifying to see them see patients with me in the clinic, work up their pathologies, help me out with the surgeries, and then see those patients in recovery. That leads to just a significant greater engagement. I think for many times for the residents, it's the first time that they've had that longitudinal experience during their training. And it's really exciting to watch somebody get excited about taking care of people and seeing that the impact that they can have on their care and the improvement that they see in the conditions that we're treating. For me, even when they come back as a senior resident, though they don't rotate with me specifically, we still do work together to some degree, but to see their skills advance and see how they've developed their clinical skills, surgical skills, and then how they've taken on the mantle of becoming educators to their own junior residents is really, really gratifying to see, and it's really the best part of my role as an educator. It really is unique within plastic surgery because you have a combination of the most straightforward procedures where someone will come and see you, have a very clearly defined pathology, you'll perform a very simple surgery, and they will recover quickly, and your interaction will be over. And that's very gratifying to fix somebody's problem. But the other end of the spectrum of patients that you take care of are some of the most complicated patients in which you develop relationships that can last years as you're shepherding them through a multiple stage reconstruction for some of the difficult injuries or resections that we see. And to have that combination of both really defined pathology that's easily solved, and as well as really difficult problems that provide a longitudinal type of interaction is really that broad spectrum of patient care that drew me to hand surgery. It also doesn't hurt that you get to sit down when you operate.